Hi, I'm Dr. Lou Graham with The New Norm, brought to you by Midway Dental and Catapult Education. There's no interview today. This is me talking to all of you, the group that's really been following this, and thank you so much for doing so. We put our heart and effort into this. With that said, there is no one person, no one group that fully understands the COVID virus. This is an ever changing, I would say, disease. And with that, the information just keeps coming forward, new updates and new understandings. With that said, we as a profession have been in some ways misguided by some of the information that we're sharing. And it's my goal to share as much information as I have read, that I've spoken with, and the discussions with many individuals. And that's my intent. With Midway Dental and Catapult Education, our intent truly is to create a community, and a community that we can work together, practice safely in a profession that we all love. So with that said, where are we with information? And right now, probably the leading information has come out of Iceland. And in Iceland, they have tested up to 10% randomly the citizens of that country. And yes, it's a small country, but there's a lot of good information coming out of that. Between 0.3 and 0.8% of the individuals of Iceland have had the virus. And here was key information. Up to 50% didn't know they had it. They had either mild symptoms or no symptoms. And what's concerning, or disconcerting, I should say, is the fact that if people don't know they have the virus, then they can be shedding the virus and obviously be actively spreading the virus to others. And that's the number one concern. How do we limit this? Yes, they're doing social distancing in Iceland. Yes, they have opened up some businesses. But it's really interesting how epidemiologists are saying we also need to be testing antibodies, because antibodies could be an immunity or temporary immunity to the virus and to the disease, and really get us going on a greater path. So with that said, it's also very interesting that in California and Italy, that both areas showed higher frequencies of the flu, or occurrences of the flu, in the fall. This was noted in California with unusual flu that probably has turned out to be COVID, and the same with Italy. So in all likelihood, this really probably started in the fall. And in the US, it came obviously to the New York area from probably European travel, and it also came to California from Asian travel. So with all this said, and the fact that we really don't know without testing who's got the virus, who doesn't have the virus, we have to think smartly. The CDC has rated dentistry the number one risk profession. So openly, the disinformation that I'm hearing is, oh, just do a better scrub of your operatory and wear masks. Are you kidding me? That is not the way to go forward. So I want to guide you with some thoughts on how to go forward. The first thought is we got to do really good screening. And screening in our practice will be twofold. 1 week before, in our morning huddle, we will be sending out to our emergency patients a screening questionnaire. And we will tell them we will be following up with you on the screening questionnaire. When we follow up with them, we're either going to do it verbally or via teledentistry. And teledentistry is like a Zoom meeting that's just HIPAA compliant, and everybody's into this. Why not be personal and do it this way? We've just started doing it in our practice. We never even knew what teledentistry is. So it's easy to do, very easy to do. With that being said, what we would do is we would verbally go over the questionnaire with each and every patient coming into our office. Yep, this is going to take time. But those questions are going to guide you to determine what test or tests or lack thereof do you need to order or have on ready at your practice when they come in? So for example, if you're going through the screening and go, are you working at a high risk facility? What would be a high risk facility? A high risk facility could be openly senior assisted living facility. If someone's working there, do you think they have the potential to have the COVID virus at a higher rate? Absolutely. What if they're working at a grocery store? You're going to ask, are you wearing masks? These are common interface questions. If they're driving a bus, driving a taxi, these are all questions. So with that, you will decide whether they need a test for the COVID test in addition to an antibody test when they walk into your office. So this is how I see it going down. I see Midway Dental offering PPEs per week so that we can all be seeing our patients. So the goal of Midway has to be, or a distributor, of course, has to be getting us the necessary PPE so we can work safely. Working safely means we've got to be doing the screening. So one of the things on PPEs, Midway Dental has just sent out a survey to, I think, a couple thousand clients about what they're offering as emergency services and how often. So imagine now every week our goal should be, let's get 10 to 20 PPE kits, 10 to 20 antibody kits, and 10 to 20 at-home testing. So what would happen after the evaluation? What would happen is your screening evaluation, if you determine that patient needs to be tested, you would tell them to come on in. The next day they will get the test. It's a spit test, a saliva test, great accuracy. They would then send that test from their home and it comes on, the results come on a portal 2 days later, 1 to 2 days later. So now you will know if that patient is COVID positive or negative. And that's critical information. You're going to ask them to practice social distancing and obviously maximum protection before they come in. When they come in, they will text you. We use a Weave app. It is sensational. We will meet them outside. They will come into the office, into our one-chair waiting room. They will be antibody tested in all likelihood. And then as we await those results, if everything looks good, then we'll do obviously a temperature reading and move on to treatment and care. This is what we all must be doing. These guidelines become imperative. You're playing Russian roulette otherwise by not screening these patients and testing these patients. Okay, so I've heard it. I've heard, oh, as dentists, we can't really administer COVID tests. Give me a freaking break. That is just not the way that's gonna be. Why? I can take blood for PRP. I can do diabetic stick tests. I can do saliva readings for periodontal disease and bugs. But I can't do COVID testing to maximize the safety of your patients, my patients, our teams? No way. I say there's just no way I'm buying that. So to me, we've got to be doing this testing. With the testing will allow us to understand, obviously, the safety when we're now working with the right PPEs that we need for these procedures. It just can't be that you're thinking every patient is a COVID patient. What we want to do is screen the COVID patients not to be coming in, waiting the 4 weeks, 6 weeks after their symptoms have gone, and we'll treat them remotely, distantly, to get them through those next 4 or 6 weeks with that emergency. Our goal has to be to practice safely. Screening and then testing. 1, 2. You're going to have to go over these screening protocols verbally with these patients. You're just going to have to, because it's not just a questionnaire that you're going to fill out. This is the new norm. Lou Graham, thanking you. There will be webinars upcoming on Catapult Education, Midway Dental, and other organizations like Ultradent, Prexion, and Mommy Dentist, where I'll be sharing protocols, next steps. On Catapult Education and Midway, we'll also be sharing the protocol questions or the survey questions that we think you should be asking. And I think this just becomes essential to guiding us safely forward. Take care, be safe, act wise. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.